To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for May 21st today, and I want to acknowledge that we're on the territories of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. Dr. Henry will be briefing at 1 o'clock on Saturday. Tomorrow there will be a written update on cases of COVID-19 in BC. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you and good afternoon. We have 12 new cases who have tested positive in BC here today, bringing our total to 2,479 people who have tested positive for COVID-19 in BC. That includes 887 people in the Vancouver Coastal Health Region, 1,223 people in the Fraser Health Region, 126 people in the Vancouver Island Health Region, 183 people in the Interior Health Region, and 60 people in the Northern Health Region. We continue to have active outbreaks in long-term care and acute care in our health system. We are now down to 17, with 14 in long-term care or assisted living and 3 in acute care. There are no new outbreaks to report, and 1 in the Windermere Care Centre has now been declared over. Of those outbreaks, we now have 537 people who have been affected, including 329 residents and 208 staff. In terms of community outbreaks, we do have 1 additional outbreak where we have a single case, and that's in the Matsqui Federal Correctional Institution, and we are working very closely with our federal correctional colleagues and Fraser Health Authority to ensure that we are doing everything to prevent any additional cases in that facility. This person was identified early and has very few risky contacts, so that's a good thing for us. And also in a positive way, the United Poultry outbreak, which was one of the first poultry facilities where we had 36 staff who were affected, has now been declared over, and that facility, as we know, is up and running again. We have now 307 active cases here in British Columbia, and of those, 43 people are in hospital, and 8 of those are in critical care or ICU. We have an additional 3 people who have died from COVID-19 in BC today, bringing the total number of people in our province who have died from COVID-19 to 152. That includes 1 person in Vancouver Coastal and 2 in long-term care and Fraser Health. And our condolences go to the families and the care providers and the communities that love these people. We now have 2,020 people who have fully recovered from COVID-19. I just wanted to report on a few additional things. We've now screened over 40,000 travelers who've come into British Columbia either from air or by land, and ensured that they had a valid isolation plan. As you know, we continue to have restrictions and require 14 days of self-isolation for people who come into British Columbia from outside of the country, and we have in addition provided over 120 people, 125 people with accommodations so that they can fulfill their self-isolation. And I'm heartened to hear that very similar measures are now being taken by Alberta, and we feel that these are important measures to protect our borders and protect all the work that we've done in the province ongoing, and we're looking to ensure that those types of measures will continue as we move through this phase of our pandemic and into the future. I also want to give you an update on some of the, there's been some media around reporting on deaths and the number of men and women who have died in the country and in the province, and we provided an update in our epidemiologic update about 2.5 weeks ago. But it's interesting that some of the reports from across the country indicate that in particularly Ontario and Quebec, where they've had the most deaths from COVID-19, that there's a majority of women who have died, and that is not the case that we've seen here in British Columbia. And just to update you, Of the total number of cases that we have, 52%, or 1,290, have been in women and 48% in men. But when we look at the number of people who've been hospitalized or in ICU, that reverses. So we have more men, about 60% of men have been hospitalized, and 64% of the people who have ended up in our intensive care unit or needed critical care have been men. In addition, when we come to the people who in BC who have died from COVID-19, 95 or 62% have been male versus 38% or 57 of whom were female. So our stats are slightly different from what we're seeing in other provinces across Canada, and are in keeping with what we have been seeing internationally as well, where there seems to be a differential, more severe effect on men than women. And again, we're not entirely sure what the rationale is for that, and there's a lot of studies that are being going on around the world to try and understand the immunology better. Another thing that has come out in the media in the last little while is about our advice around the additional precaution that can be layered on to what we know works to prevent the transmission of COVID-19, and that includes the use of a non-medical mask in certain situations. So as we know, the things that we continue to need to do to prevent transmission of this virus are to stay home and away from others if we're sick ourselves, to keep that safe distance, and all of our restart plans are really focused around making sure that we can reduce the number of people that are in a place, making sure that we have physical barriers in place, making sure that we can keep our safe distance from others to prevent transmission. Obviously, washing our hands regularly and covering our cough are really important, and cleaning and disinfecting common surfaces. But an additional layer in some situations that can prevent you from letting your droplets out includes the wearing of a cloth or non-medical mask. And it can play an important role in some of those situations, particularly in enclosed or crowded settings where you might be indoors. And some of the settings where it might be a really important additional layer is on settings like public transit, where you may not be able to always maintain that distance, or in small retail stores, for example, where barriers or other measures that are more effective may not be always in place. So for us, I've talked about this before, it is an additional layer that is appropriate in some settings, and it's really a way of protecting others from our own droplets and keeping our own droplets from going into the surfaces around us. And really it's a measure of being polite and respect for others. And in that sense, it certainly is something that people can consider, and we would recommend in certain situations for those small periods of time where you may not be able to control your distance. Other situations, of course, that it is going to be helpful are in situations where you need to be within somebody's safe space for a period of time, and we're thinking of things like physiotherapy or massage or hairstylists, where if both of you are wearing a mask, it keeps both of you from spreading your droplets to each other. The other thing, of course, that has been on a lot of people's minds in the last few days is about our plans to reopen in-classroom schooling for some children come June. This is an approach that's been taken with considerable thought and cautiousness, and I have confidence in the approach that we have developed for June. Schools will have strict protocols, enhanced infection and prevention. Workplace health and safety has been involved in ensuring that we have the right measures in place. And again, it fits into all of the other things that we are doing to live with this virus in a way that keeps people as safe as absolutely possible. And that will include much smaller numbers, keeping physical distance within classrooms, making sure that we have processes in place to exclude anybody who feels unwell, And I know people have been concerned about some of the language around that and how will we know. And certainly if anybody in a family has an illness that could be COVID-19, then we are saying be cautious and keep the other family members home as well. But to make sure that you have it checked out, you call your family doctor, call 811. We also know that anybody who has tested positive for COVID, that their close contacts will be contacted by public health, and they will stay away and stay home for the period of the incubation period after their exposure. So these are the things that we have in place, and we know that this is going to be a challenging time for some people, and it's going to be nerve-wracking for all of us as we get used to having these provisions in place and knowing what to do. But we do have, like all illnesses that can be transmitted in close contact in a school setting, we do have a notification process. We have processes in place to ensure we know what to do and that we can safely separate somebody who's feeling unwell, and public health will be there to support you to make sure that we have what we need in place in our school settings. Finally, the province-wide Your Story, Our Future survey continues to be available for people. We've had over 290,000 British Columbians so far who've completed the survey, and I would encourage everybody to, if you've done it yourself, to pass it around to friends, to help others access it as well. So as we've said, we are in this second phase. We need to be slow and thoughtful as we move through this. We need to watch carefully, and that is what we are doing in public health over the coming days and weeks. And we are here to work with you, whether it's through WorkSafe BC, your local environmental health office and public health officers. We'll work out the kinks over the coming weeks as we gradually open up to that place where we can sustain it for a period of time. We are watching closely, and we all need to continue to commit to those important measures so that we don't lose all the gains that we've had in the last few months and all the work and the sacrifices that we've made across the province. We need to continue to do all we can to protect our families and our communities across the province. And we do that by supporting each other and working together on this and continuing to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry, and I wanted to join Dr. Henry in expressing condolences to the families, the friends, the caregivers of the 3 people who passed away, 2 of them in Fraser Health and 1 in Vancouver Coastal Health in the last 24 hours from COVID-19. It is, I think, always worthy of reflection, of lives lived, of people that are lost, but who have lived extraordinary lives, in all 3 cases, long lives, and who've passed away. And we know, regardless of the circumstances, that is difficult, and in these circumstances is extremely difficult. And we want all of you to know that we are, especially the families, but all those including the communities involved, that we hear your sorrow and we stand with you. I wanted to note on that point that 2 of these cases were from long-term care, and that we are continuing the policies, the severe restrictions that have been put in place on visitors in long-term care and acute care. And I know personally, and I think we all know, how significant and how serious and how difficult that process is. We continue to have 14 outbreaks in long-term care. We've seen in the growth of cases, for example, at the Langley Lodge, even in recent weeks, that this continues to be a significant issue for us. British Columbia has done significantly better than other jurisdictions, but that doesn't change the fact that a lot of people have lost their lives, and the situation in long-term care remains serious. And the measures that have been put in place by medical health officers across British Columbia to protect residents in long-term care must continue to be in place. And I'm going to report on one of those initiatives, the single site initiative, shortly. I note that there are 43 people currently hospitalized in BC. That's 21 in Fraser Health, 19 in Vancouver Coastal Health, and 1 in each of the 3 other health authorities. that increasingly our hospitals are slowly becoming more occupied. About 69% of beds are occupied across the system at the moment, and 53% of critical care beds are occupied at present. Yesterday we had 5,101 emergency room visits in BC, which shows we're continuing to see that new level of people appropriately using the healthcare system. This is happening at different rates in different health authorities. For example, we're much closer to 100% in ERs of pre-COVID levels on Vancouver Island than anywhere else. But nonetheless, people are doing that, and our healthcare system for all non-COVID procedures is becoming busier. I wanted to provide a fourth update to you on the single site proposal. This is a proposal, or the policy. This is the policy that employees in long-term care, assisted living, private hospitals, standalone extended care hospitals, and provincial mental health facilities are restricted to working at a single site. We started with 545 facilities, hosting multiple facilities employees, with a total of 7,350 employees who worked at multiple sites. Here's where we are right now. Of those 545 facilities, 499 have completed their single site plan. That's an increase of 4 sites from last week. Others are in process, but again, we are not reporting in process plans, just completed ones. That's 121 in interior health. That's a correction from last week when it was 122. It's 121 in interior health, 141 in Fraser Health, including 2 provincial health services sites, 96 in Vancouver Coastal Health, including 6 Providence healthcare sites, 106 in Island Health, and 35 in Northern Health. The number of site plans announced today are the ones that are completed, and but others, and the others, the ones taking us to 545, are in the process of being completed. As I mentioned last week, the ministry continues to work with health authorities to gather detailed information from non-Health Employer Association of BC sites on current compensation. This has been a complex task, as health authorities and the ministry have not had insight into the actual wage and benefit costs at many private and not-for-profit locations. The ministry has worked with legal services, health authorities, and industry partners to develop a provincial template and process. A webinar to support implementing the template is planned for Tuesday, May 26, 2020. Once the information is received, the ministry will be analyzing that information with health authorities to ensure that all the appropriate funding flows from contractors and employers to frontline staff. Again, funding is expected to flow in early to mid-June and will be retroactive. With regard to overall cost per month, as I noted last month, we'll provide detailed information on all of the contracts once this process has been completed. The move to single site is complex, but it is necessary, a shift in our approach to care. I want to thank everybody, from unions to providers to those managing the care sector, for their cooperation in this effort. We'll continue to update you every Thursday so that people are aware of our progress in this regard. I wanted to also bring you up to date on progress with respect to surgeries. As you'll be aware, on March 16th, we delayed all non-urgent elective surgeries, and our estimate of the total number of surgeries that represented was approximately 30,000 for that 2-month period. Of course, we continue to provide urgent scheduled surgeries and emergency or emergent surgeries in that time. So from the period from March 16th to May 17th, we completed 20,000, or the system completed, and doctors and nurses and healthcare workers completed 23,385 surgeries. That's 4,015 in interior health, 7,121 in Fraser Health, 4,879 in Vancouver Coastal Health, 4,720 in Vancouver Island Health, 1,365 in Northern Health, and 1,285 in the Provincial Health Services Authority. Of those 23,000, 12,369 were scheduled and 11,016 were unscheduled or emergency surgeries. This is, I think, given the challenges facing the healthcare system in this time, an extraordinary achievement by our healthcare workers, and we are grateful for it. As you all know, on May 7th, we announced our new surgical plan to try and respond to relaunch elective or scheduled surgeries in BC. From May 7th to May 17th, we contacted 12,016 patients in BC as part of that plan. And this week, the surgeries booked this week, the scheduled surgeries booked this week, amount to 2,586 in the first week. So the first scheduled surgeries on May 18th to those that are scheduled through May the 24th. Again, we're getting started. It's a very challenging process, but what this indicates is the commitment of our surgeons, of our nurses, of our healthcare workers to providing the same energy in addressing people waiting for surgeries as we've provided in our response to COVID-19. Last week, I provided two such updates on surgery and our surgery renewal commitment. 2 days ago, I was able to announce that postponed surgeries had resumed in 49 sites across 5 regional health authorities and the Provincial Health Services Authority. And today we added this detailed information on our progress. That word, progress, is an important word in delivering on surgery renewal. Important because as much as surgery renewal depends on those in the operating room, it also depends on all of us. It depends on our ongoing commitment to use the skills we've learned from Dr. Henry and from public health officials to stop the spread. As Dr. Henry has made clear, a second wave of COVID-19 is very likely given the history of pandemics. And as we made clear in our surgery renewal commitment, we expect to complete all lost surgeries. But let's make no mistake about it. Surgery renewal is shaped by COVID-19. Our success will be dictated by future events, such as a resurgence of COVID-19 or the potential for a second wave. As we head into our first weekend of phase 2, an exciting time because of the reduction of some restrictions and the increase in our contacts, we need to continue to be 100% all in our efforts to prevent a resurgence of COVID-19. We want to stay healthy to allow the progress we've been making on surgery renewal to build. For the weeks and months ahead, the only thing any of us wants to spread in BC, through our words and our actions, is the messaging that physical distancing matters. Physical distancing saves lives, it stops the spread, it flattens the curve, and it gets people the surgeries they need. Physical distancing saves lives. Spread the message, not the virus. Aujourd'hui, nous annonçons 12 nouveaux cas pour un total de 2479 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19, dont un dans le région de santé de Vancouver Coastal et 2 dans le région de santé de Fraser, pour un total de 152 décès en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 43 personnes sont actuellement hospitalisées, dont 8 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Alors que nous allons vers notre premier week-end de la phase 2, une période excitante en raison de la réduction des restrictions et de l'augmentation de nos contacts, nous devons continuer nos efforts à 100% afin d'empêcher une reprise de COVID-19. Nous voulons rester en bonne santé pour que nos progrès sur le renouvellement des chirurgies puissent se développer. Pour les semaines et les mois à venir, la seule chose que nous voulons répandre en Colombie-Britannique, par nos paroles et nos actions, est le message que la distance physique est importante. La distance physique sauve des vies, elle arrête la propagation, elle aplatit la courbe et elle permet aux gens d'avoir des chirurgies qu'ils ont besoin. La distance physique sauve des vies, fait passer le message, pas le virus. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you. As a reminder to everybody on the phone, please press star 1 to enter the queue. You will be limited to 1 question. Also, please unmute your phones. You will not be audible until I call your name. First question is from Penny Daflo, CTV.
Thanks so much for taking my question. Dr. Henry, TransLink talked today about growing a culture of mask wearing on transit. So I'd like to hear some more of your thoughts on that, as well as just kind of making it part of our public life more broadly, especially given that WorkSafe has made masks a significant part of their guidelines for so many businesses where distancing isn't possible.
Yeah, so I do think, and we've talked about this as well over time. Now that we know more about the virus, I think there are situations where it is important for us to cover our droplets, and some transit is a classic example, where I think what we need to realize is that not everybody can safely wear a mask. So we need to be respectful of that as well. But it is a way for us to keep our droplets in, to be respectful of others. And transit is a place where you cannot always maintain that distance. We have been working with transit, of course, to ensure that there are physical distancing measures being put in place as well, so that we're not in those crowded situations where this virus could take a chance of spreading. But I will also say that, there are many other situations like getting our hair cut, as I mentioned, massage therapy, other places where we, by the nature of the business, we need to be in close contact with someone. And that's where both of us wearing masks is important. And what we're talking about is non-medical masks in most of these situations. So yes, it is something that we should get used to. Where I don't think we need to think about it is if we're out by ourselves outside, unless you're unless you're going to a place where where you might be in close contact with somebody. But if we're able to maintain our physical distancing, that is an important way as well. And we know that if the mask gets wet or soaked through, that it's not very helpful at all, even in keeping your droplets in, and you're more likely to touch your face and adjust it and things. So those are the things we need to get used to over time. For some people, once they get used to wearing it, it is a way of actually stopping them from touching their face, which is good. And we need to be careful when we put it on and take it off, and they need to be washed regularly. But they can also be kept in a little bag in your purse, so that you can take them with you, so that you have it when you need it. So I do think it is going to be a part of our future for a while, and how that evolves in terms of culturally for the long term, we'll wait and see.
Next question is from Mary Griffin, CHEK News.
Oh, hi. Hello, Dr. Henry. Thanks very much for taking my call. You have talked about this on a number of occasions, but not at the briefing since the restart of the economy. And I'm just wondering, why would there be a second wave of the pandemic, and what could potentially cause that second wave?
Yeah, we know this virus hasn't left, and it is circulating in our community, and that's why we're doing this so cautiously and thoughtfully. And if we look at the modeling of what we've seen in other places and what we've seen here in BC, there is a potential for it to start transmitting quite rapidly in our community. We've seen that in other places where you get rapid increases in numbers of people who are infected in a short period of time. Right now, a case in point is in South Korea, where there's been quite a lot of transmission from somebody who inadvertently went to a number of nightclubs and spread it to a variety of people, a couple hundreds, maybe even thousands. So those are the types of situations we want to avoid right now. What I'm talking about longer term is there is some seasonality to respiratory viruses historically, particularly with influenza. We know that influenza fades away in March, usually, or sometimes April here in the Northern Hemisphere, and we tend to have very low levels or very little influenza during the summer, but we know it comes back in the following fall. And we know that is the pattern that we see with other coronaviruses. So chances are we are going to see that with this coronavirus as well. So even if we're able to control it well during the summer, the chances are that just the climatic conditions will naturally allow it to increase in prevalence during the fall. I mean, I would really like to think that's not going to happen, but if we look historically at all of the pandemics that we have historical data about, that is what has happened. And sometimes we've seen a bigger wave in the second wave, sometimes it's been smaller, so we don't know what that's going to look like, but we need to watch very carefully to see. I know, though, I can say with some certainty that we are going to have respiratory illnesses in the fall, and we're going to have influenza, we're going to have RSV, we're going to have parainfluenza, influenza, we're going to have other things that are causing people to get sick with very similar symptoms to COVID. So we need to be prepared to be able to test for those, to test for COVID, to be able to determine which are which. And so that's why I think it's so important for us to maintain the lid on the numbers of cases that we're seeing through the summer, so that we're not starting off with a lot of spread in our community, and we've seen that in some other places around the world, but also to have the testing and the contact tracing and all of those things that we know are important to have in place come the fall, so we're able to manage this and that we're able to manage it without overwhelming our healthcare system.
Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry. I see that in our mutual hometown, in fact, in the Vancouver Island Health Region, there's only one active case now, according to the dashboard. I'm wondering whether phasing out restrictions, altering them on a regional basis, is something that BC could be considering now.
Yeah, so no. So I don't believe we're at that point where that will make sense for us. We do know that people move, and we do know as well that this virus, we are not catching everybody that has it. We know it is still in our communities. So the cases that we have that have tested positive are a good indication, and we are watching very carefully. But the philosophy that we need to have across the province, and we're talking with my colleagues across the country for the coming period of time, is we don't want to give this virus those opportunities to start spreading to large numbers of people. So yes, we are increasing our social connections, but within limits. We're increasing our ability to go to retail stores and restaurants and other places, but with those limits in place. And those are very specific, and I believe they are needed, and we believe they're needed based on the evidence that we have about how this virus spreads. So people have asked about why we are still saying restrictions in gatherings of 50 people. And if you are in a large space. And partly that is so that we can make our contact tracing more efficient, but it's also partly because if somebody is carrying the virus and inadvertently spreads it, it's not going to spread to thousands of people. It's going to spread to smaller numbers, and we can control that, and we can care for those people effectively. So that's what we need to think about going forward. We need to think about where we can find that balance of stopping the transmission of this virus, but also reducing the unintended negative consequences on everybody else from the restrictive measures that are put in place. So that's what we have been trying to do with our Restart program, starting slowly, making sure that we're monitoring very carefully and that we're not giving opportunities for widespread rapidly in the coming months, and then, of course, as we go into the fall.
Next question is from Tanya Fletcher, CBC.
Hi there. I'm wondering if you can comment on the decision to ban non-BC residents from provincial campsites this summer. You've adamantly been against closing provincial borders in the past over the long weekends, but this seems like a direct way to keep out-of-province visitors away. So how do you hope this will protect British Columbians? And I have a request for an answer in French as well, please. Thank you.
I'm not aware of that ban, to be honest, so it wasn't me.
I think the appropriate person, I'm sure he's either already answered or talked about it, is Minister George Heyman. I think what we're trying to do, and you've seen other jurisdictions take the step that you're talking about, I believe Alberta and Saskatchewan and Manitoba, is to control to a degree non-essential travel or overnight travel. So it's just a prudent step that's being taken. It's also being done to assure access, potentially access, should such campsites be reopened at some point in the summer, and that's the direction we may be going. But should they be opened at some point during the summer, it's to ensure that British Columbians have access and full access in a summer where we're saying to people in British Columbia not to travel internationally, not to leave the province, but to ensure that people in British Columbia have access here and have access to campsites, potentially campsites in provincial parks. So I think it's a similar direction to the direction of other Western provinces, and I'm sure that Minister Heyman would be able to expand at length if you asked him directly. En français, c'est bien. Merci beaucoup. Merci beaucoup. Juste pour dire que vraiment c'est la même politique que d'autres provinces de l'ouest du Canada. Ça va jouer un rôle, bien entendu, sur la transmission de COVID-19. Mais si on ouvre l'opportunité de faire du camping en Colombie-Britannique, c'est important pendant un été où la grande majorité des gens en Colombie-Britannique ne vont pas aller ailleurs, ne vont pas aller à l'extérieur de la province en général. Surtout, ne peut pas travailler sur le plan international, voyager sur le plan international, qu'il y a des opportunités pour ceux et celles qui veulent utiliser nos parcs provinciaux ici en Colombie-Britannique, de les utiliser. Donc, c'était pour cela, je pense que le ministre Heyman a pris cette décision et je suis certain que le ministre Heyman serait en mesure de vous répondre en détail, même peut-être en français, si vous avez des questions.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. I guess my question today is about I guess it's hard to put this in words, but growing pushback from people who are worried about having to leave their name at a restaurant and contact information, or people who are saying that they don't want to be forced to wear a mask if they don't want to. How do you stress the importance of the need for this, that not necessarily as a violation of somebody's privacy, but the need to have this information so we can trace if there are new outbreaks coming out? Because there's a lot of confusion about whether or not people's rights are being violated if they're entering a restaurant or if they're getting on a bus without a mask.
Yeah, so as I've said with respect to masks, I do think we need to be cognizant that not everybody has the ability to wear a mask or will want to wear a mask. And I don't believe it's an issue of rights or privacy. We are doing it as a recommendation. We're encouraging people as a mark of respect, as a mark of politeness and paying attention to the welfare of others. So with respect to masks, I don't expect us to make them a requirement in any settings. In BC, I know they are a requirement for flying on airplanes, and that's fine. That's obviously an environment where it may be appropriate. So in terms of leaving a name at a restaurant, actually this was an idea that came from the Restaurant Association, and most restaurants, they often take names and reservations and phone numbers. So I had not heard that people had concerns about that. The only place that I had heard about concerns from that was some fast food restaurants where the nature of their business. And what we have said is that is our advice. And it's our advice because if we have an exposure event in that setting, it allows us to contact people more rapidly and make sure that they have the information they need to keep themselves and their families safe. So it's not about trying to and we're not going to access that information unless it's absolutely necessary. We have in the past used many different things to connect with people in those types of settings. For example, we can get access to things like credit card information or people's loyalty card information from a grocery store when we've had outbreaks that we've allowed us to understand what might be causing the outbreak. So those types of things we do. We are obviously in public health our paramount concern, and you will have seen this from the information that I've provided over the last number of months, is maintaining people's personal confidentiality. So that is a very important thing that we do all the time. And this is just another measure, as you say, to try and improve our efficiency on being able to contact people and give them health information that might be of value to them and to their families.
I just say that I think these measures are modest and useful and necessary. And just to put it in context, more than 150 people have died from COVID-19 in BC. Today, just today in Ontario and Quebec, they announced 113 more deaths in just those two provinces, just today in late May. Thousands, tens of thousands of people have been affected. People have lost work and opportunity around the world. Hundreds of thousands of people have died around the world. Millions, tens of millions, hundreds of millions of people and more have been affected. And so these small actions, physical distancing, is what we owe to one another to help prevent the spread of the virus, what we owe to one another to return not to the old normal but to a new normal, what we owe to one another to help one another in a very difficult time. And so I strongly encourage people to view it that way. It's not a question of rights, but a question of our obligation to one another as human beings in an extraordinarily difficult time. And I ask people to, with all my heart, to follow the recommendations around physical distancing, to be generous and cooperative and open-hearted with one another, to, as Dr. Henry has frequently said, to be kind.
Next question is from Tyler Olson, Abbotsford News.
Hi, thanks. Dr. Bonnie Henry and Mr. Dix, you both have repeatedly, and Mr. Dix, you just did right before I started here, emphasized the importance of personal responsibility in suppressing the virus. Compared to other jurisdictions, do you think BC has placed a larger emphasis on individual responsibility rather than implementing lockdown restrictions? And if so, do you think that's made a particular impact in kind of the way BC has been able to be successful?
I think it is one of the things that we've come out with in terms of our approach to how we manage this, and it has been something that I am very grateful that people in British Columbia have understood and paid attention to. It is only by getting through this together that we will be successful. I think a lot of what happened here in British Columbia, because it was around timing, and much of that may have been luck and the right way, doing the right thing at the right time and making those decisions. But we cannot underestimate how important it is for us to have that collectiveness in managing these events that really are out of our control. There are so much about what happened with this pandemic and what will happen with this pandemic that we cannot control. So the only way that we can make it through together is to have that personal accountability to each other and to be respectful of each other, and to do it in a way that supports each other to get through it. Because, I heard it said recently, and I thought there was a good analogy. We're all in the same storm, but we're not all in the same boat. And so we need to have allowances for that, and to be respectful that everybody has their own experience of this last few months and what the next few months will be. And for all of us to accept that and to have that compassion and respect for others is what is going to help us get through this next phase and whatever comes next.
We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Keith Baldry, Global News.
Hi, thanks for this, Dr. Henry. Langley Lodge, you mentioned a couple days ago, and after that briefing, Langley Lodge put out a tweet saying everything was fine there, and people were improving, and that wasn't reflected in the numbers. It's my understanding 2 of the deaths overnight occurred in Langley Lodge. Can you explain just what your team is doing in terms of investigating that facility?
Yeah, so I know that Fraser Health has been very active working with all of the staff and the residents and families in that facility. We've seen over and over again that once the virus gets into the facility and once people are, have been exposed, we know that there's going to be ongoing development of illness. And for some people, particularly our elders and seniors, that illness can be very mild and very sudden and very and unfortunately lead to death very quickly. I know Fraser Health and all of the team, the care team at Langley Lodge is been devastated by this outbreak and is working very hard to make sure that it is under control.
That's all the time we have for today. Thank you.
Thank you very much.
Thank you.